For decades, we've been told that regular health checkups are the key to staying ahead of illness, the smart and responsible thing to do, especially as we get older. But what if we told you that some of those very tests, the ones we've always trusted, might not be as helpful after age 70 as you've been led to believe? In fact, they could even do more harm than good. Welcome to Senior Health Boost, your trusted source for clear, science-based health insights designed for those navigating life beyond 60. Today's video explores a topic that often gets overlooked in mainstream healthcare. Which medical tests might no longer be necessary, or even safe, for older adults? This isn't about fear. This is about empowerment, giving you the knowledge to make informed, thoughtful choices about your healthcare. As we age, our bodies change, and so should the way we approach prevention. Medical screenings that once made perfect sense in your 50s or 60s may bring increased risks in your 70s, 80s, or beyond. Yet, many older adults continue to undergo these procedures out of habit, fear, or simply because that's what we've always done. In this video, we'll break down 5 health checkups you may want to reconsider after age 70. The potential risks and hidden downsides that often go undiscussed. And most importantly, what safer, more age-appropriate options are available to help you stay informed and in control of your care. We'll also share real stories, data-driven insights, and expert-backed guidance to help you make the best choices for your unique stage of life. So if you're over 70, or love someone who is, stay tuned. What you'll learn today could protect not just your health, but your independence, your time, and your peace of mind. Let's get started. Setting the stage, aging and risk. As someone who's spent decades in the world of medicine, in hospitals, clinics, and across the kitchen tables of worried families, I can tell you with certainty, aging changes everything. Not just how our bodies feel, but how they respond to procedures, medications, and even simple medical tests. That's why one of the most important questions we can ask in our 70s and beyond isn't just, is this test accurate? It's, is this test still appropriate for me right now? Let's break that down. The risk-benefit balance shifts with age. In your 50s, many screening tests, colonoscopies, cardiac stress tests, full body scans, made perfect sense. You were likely strong enough to handle the side effects. Your body recovered quickly, and you had a longer time horizon for any slow-growing conditions to become relevant. But once we enter our 70s or 80s, that math starts to shift. The body processes anesthesia more slowly. Healing takes longer. Dehydration, infections, and complications from procedures become more common. And the likelihood of discovering something benign that looks concerning skyrockets. What used to be a clear yes now deserves a thoughtful, personalized discussion. More testing does not equal more safety. There's a deeply ingrained belief in modern medicine, especially among older generations, that doing something means we're being safe. That more scans, more scopes, more pokes mean we're staying ahead of disease. It's a comforting idea, but unfortunately, it's outdated. We now know that over-testing can lead to overdiagnosis, the discovery of conditions that would have never caused harm but now trigger a cascade of unnecessary procedures. Stress and side effects. Think of it this way. Not every shadow on a scan needs to be chased. Not every irregular heartbeat needs a stent. Not every polyp needs to be removed, especially if removing it does more harm than good. The difference between protocol and personalization. Medical guidelines were built around averages, not around you. And for many years, those guidelines didn't take aging bodies into account. The truth is, what worked at 55 may not serve you at 75. That's not neglect, that's wisdom. This is where individualized care matters. It's about shifting the focus from doing everything to doing what truly helps. It's about listening to your body, understanding your real risk factors, and working with your provider to choose tests and treatments that respect your current stage of life. So before we dive into the 5 checkups you may want to rethink, just remember, being proactive doesn't mean doing more. Sometimes, it means doing less, with purpose. And that single shift in mindset? It can change everything. The 5 medical tests to rethink after 70. 1. Colonoscopy after 70. When prevention turns into risk. For many decades, Colonoscopy has been seen as the gold standard in colorectal cancer prevention. And for good reason. Catching polyps early has saved countless lives. But once you reach your 70s, the decision to undergo this invasive procedure needs to be made with far more caution. Here's why. Colonoscopy involves full bowel prep, usually through powerful laxatives that aggressively flush your digestive system. In younger adults, this can be uncomfortable. In older adults, it can be dangerous. Dehydration, electrolyte imbalances, and drops in blood pressure are all far more common in seniors, and those conditions alone can lead to falls, confusion, or hospitalization. Then comes sedation. As we age, our liver and kidneys don't metabolize medications as quickly, which means sedatives linger longer in the body. For seniors, especially those living alone, the grogginess after a procedure can last for hours or even days, increasing the risk of disorientation or falls. Let me tell you about George, an 82-year-old retired accountant. He was healthy, sharp, and independent. He had already had 2 clean colonoscopies before, but during a routine checkup, his provider encouraged him to do just one more. George agreed. The prep left him weak and dehydrated. After the procedure, still groggy from sedation, he fell at home that night. He fractured his hip and ended up spending 3 months in rehab. The worst part? The colonoscopy found absolutely nothing. Here's the deeper issue. Many polyps take 10 to 15 years to become cancerous, if they ever do. So at age 75 or 80, detecting a tiny polyp often triggers more testing, biopsies, and sometimes bowel surgery, for something that might never have caused harm in your lifetime. A smarter alternative? Non-invasive stool tests like FIT, fecal immunochemical test, or Cologuard. They're easier, safer, require no prep or sedation, and in many cases, provide a very reliable screening outcome without the same level of risk. Bottom line, if you're over 70, especially if you've had prior clean colonoscopies and you're not experiencing any symptoms, it's absolutely reasonable to say no to routine colonoscopies and opt for safer alternatives instead. 2. Full body scans. The false promise of catching everything. There's something deeply appealing about the idea of a full body scan. You lie on a table, and a machine scans you from head to toe, searching for hidden dangers. It sounds smart, even heroic. But for older adults, it can be a trap. CT scans and MRIs are incredibly sensitive. That's their job, to detect anything. But sometimes, they're too good at it. What they often find are called incidentalomas, tiny nodules, shadows, or abnormalities that look suspicious but are completely harmless. Once found, though, they rarely get ignored. They lead to follow-up imaging, biopsies, anxiety, and even surgeries. Many of these follow-ups are not only unnecessary, they can be dangerous in older adults. Take Betty, a vibrant 78-year-old who felt perfectly healthy. At a community health fair, she was offered a discounted full-body scan. It showed a small 3 mm lesion on her kidney. That finding spiraled into multiple ultrasounds, a referral to a urologist, and eventually surgery. Post-op recovery was hard on her. She lost stamina, experienced complications, and never quite regained her previous vitality. The lesion? Benign. That's the hidden danger of full-body scans in seniors: overdiagnosis. You think you're buying peace of mind, but often, you're buying a ticket into a system that won't let you go, test after test, specialist after specialist. A better approach? Stick to symptom-driven diagnostics. If something feels off, pursue it. If you feel great, don't go looking for problems that may never have existed. And when you do need a scan, make sure it's focused and relevant, not head to toe without cause. Key takeaway. In medicine, more information isn't always better. Sometimes, it just makes you worry more. After 70, full body scans can cause more emotional and physical harm than benefit, and should only be used with a clear clinical reason. 3. Cardiac stress tests. When the treadmill does more than test your heart. Cardiac stress testing is one of the most common procedures ordered in people over 60, often as part of a routine physical. Even if the person has no symptoms. The idea sounds logical. Push your heart. See how it handles stress, and catch any problems early. But here's what's important to know. In people over 70 who don't have any symptoms, this test can often do more harm than good. Here's why. As we age, it's normal for our arteries to stiffen a bit, for the electrical activity in our hearts to shift slightly, or for recovery after exertion to slow down. These are normal age-related changes. But to a cardiac stress test, they can look like red flags. That's where the trouble begins. A false positive leads to a referral to a cardiologist. The cardiologist orders an angiogram. That leads to a stent, and suddenly, you're on blood thinners, limited activity, and dealing with complications you never needed to begin with. I think of Harold, a retired school bus driver. At 76, he was active, played with his grandkids, and never had chest pain. At a checkup, his doctor, just to be safe, ordered a treadmill test. The result was mildly abnormal. That led to a catheterization, then a stent, and then a severe GI bleed from the blood thinners. He spent 2 weeks in the hospital and never fully bounced back. Smarter option? If you're not having symptoms, like chest pain, shortness of breath, or unexplained fatigue, there's usually no need for stress testing. Instead, focus on heart-healthy living, walking daily, eating a Mediterranean-style diet, keeping your blood pressure and cholesterol in check, and managing stress. Lesson. Testing should follow symptoms, not fear. Don't let your heart be treated like it's broken when it's simply aging naturally. 4. Repeat colonoscopies without symptoms. When, just to be safe, backfires. Let's revisit colonoscopies, not the first one, but the repeat ones. A lot of people are told, you had a clean colonoscopy at 65? Great, let's do another at 70. Just to be safe. But here's the thing. If your first and second colonoscopies were clear, and you're not having any symptoms, no blood in the stool, no unexplained weight loss, no abdominal pain, there's very little benefit to repeating the procedure after 75. The risks, however, continue to rise. One of my patients, Eileen, had a clean colonoscopy at 68 and again at 73. At 78, her doctor suggested another, just in case. She agreed. During the procedure, her colon was accidentally perforated. She required emergency surgery, spent nearly a month in the hospital, and was never quite the same afterward. Her independence declined, her energy dipped, and all for a test that, in hindsight, didn't need to happen. The sedation risks we discussed earlier apply here. But so does postoperative cognitive dysfunction, a common but under-discussed issue in older adults after anesthesia. Confusion, foggy memory, and emotional imbalance can persist for weeks or even months. Better alternative? Skip repeat colonoscopies if your history has been clean and you're not having active GI symptoms. If screening is still warranted, consider non-invasive stool tests instead. Takeaway: if your track record is clean, and your gut is quiet, there's no need to go back in just to make sure. Trust your history, and prioritize procedures that protect your quality of life. 5. Overzealous heart monitoring without symptoms. When watchfulness becomes overkill. In cardiology, there's a constant push toward earlier detection. More devices, more monitoring. For younger patients with risk factors or symptoms, that can be life-saving. But for many older adults, it leads to unnecessary anxiety. Medications and interventions. Holter monitors, 24-hour blood pressure cuffs, event recorders, implantable loop recorders. These tools are designed to catch rhythm disturbances, but often, they catch normal, age-related variation. The danger? You're told you have atrial ectopy or mild bradycardia, and suddenly you're on meds that lower your heart rate. Or you're scheduled for a pacemaker, all without ever feeling a single symptom. Testing becomes a trap. When that cascade begins, it's hard to stop. You go from one monitor to the next test to the next consult, and suddenly, your world starts revolving around your heart, even though it wasn't causing you any trouble. Smarter alternative? Let your symptoms guide the care. If you're feeling good, no dizziness, fainting, skipped beats, or shortness of breath, let it be. Monitor your blood pressure, walk daily, manage stress, focus on the fundamentals. Final thought: after 70, you don't need to monitor every beat. You need to listen to how you feel and protect your peace of mind. The bigger picture. The problem with too much medicine. If you've ever left a doctor's office feeling overwhelmed instead of reassured, you're not alone. We live in a world where the message is clear. More tests mean more safety. More scans mean more certainty. And saying yes to every procedure is the responsible thing to do, especially as we get older. But after decades in medicine, and after listening to thousands of stories from older adults, I can tell you with certainty, more medicine doesn't always mean better medicine. In fact, too much medicine can become a serious risk, one that isn't often talked about in the exam room. What overdiagnosis really looks like. Let's say you're 74, feeling fine, and go in for a full body scan, just to be proactive. The scan shows a small shadow on your lung. It's probably nothing, but no one wants to take that chance. So you're referred to a pulmonologist. Then a biopsy. It's inconclusive. Now they're talking about a surgical biopsy. General anesthesia, a hospital stay. By the time it's all over, they find scar tissue from an old infection. Not cancer, not a threat, just a harmless finding that set off a domino effect. This is overdiagnosis. It's when we find a problem that was never going to hurt you, but now that it's found, it can't be ignored. It pulls you into the system, into more testing, more specialists, more worry, and sometimes, into treatments that come with real, lasting consequences. The real cost of unnecessary procedures. We often talk about the physical risks of unnecessary procedures, infections, complications, long recovery times. But what gets overlooked is the toll these interventions take on your mind, your wallet, and your independence. Let's be honest, time in a hospital isn't just inconvenient. For many older adults, it can be a turning point. A minor procedure that goes wrong can lead to a fall, a stroke, a loss of mobility, or months of rehab. The emotional cost is just as real. Many seniors describe feeling lost, anxious, or unsure who to trust after going through an unnecessary medical ordeal. And then there's the financial side. Even with insurance, co-pays, deductibles, travel costs, and follow-up visits can be overwhelming. It's not uncommon for someone to spend thousands of dollars chasing a finding that was never a real threat to begin with. Why medicine chases certainty, even when it shouldn't? There's a reason this happens. Modern medicine is built on the principle of certainty. We're trained to diagnose, investigate, eliminate all doubt. Doctors are taught to fear the missed diagnosis, the lawsuit, the regret. So out of an abundance of caution, the system says, let's scan it, biopsy it, treat it, just in case. But here's the problem. In older adults, the balance between risk and benefit changes dramatically. What might be a low-risk procedure for a 45-year-old can be a very different story for someone at 78. And the truth is, certainty is an illusion. We can't scan or test our way into a perfectly safe future. Sometimes, chasing certainty only creates chaos. Why? More doesn't mean safer for seniors. After 70, the goal of healthcare should shift. It's no longer about detecting every potential problem. It's about protecting what matters most. Your energy, your clarity, your independence, your peace of mind. Sometimes, doing less is the most protective thing you can do. That's not neglect. That's wisdom. It's knowing that the value of a test isn't just in what it shows, it's in what it leads to. And if what it leads to could cause more harm than good, then it's okay, even smart, to say no thank you. Advocating for yourself. The power of saying no. One of the most important things I've learned in my career is this. Older adults who thrive the longest aren't always the ones who say yes to everything. They're the ones who ask questions, who think critically, who know when to say, this isn't for me. If a test won't change your treatment, if it won't improve your quality of life, if it comes with more risk than reward, then it's okay to choose not to do it. Ask your doctor, will this test change how you treat me? What are the risks, not just of the test, but of the treatments that might follow? What happens if I don't do it? These are fair questions, and any doctor who respects you and understands aging will welcome that kind of dialogue. So as you think about your own health journey, remember this: you are not just a patient. You are a partner in your care. You are allowed to protect your time. You are allowed to protect your energy. And you are allowed to protect your life from the unintended consequences of too much medicine. Because in this chapter, less isn't giving up, it's choosing wisely. Real conversations you should have with your doctor. Let me be very clear, your doctor works for you. That doesn't mean you should distrust them, quite the opposite. It means you're a partner in your care, not a passive participant. And after 70, the quality of that partnership matters more than ever. The best way to protect your health isn't always through another test or scan, it's through an honest conversation. A conversation that puts your goals, your comfort, and your quality of life at the center of every decision. Here are 3 powerful questions I encourage every senior to ask before agreeing to any new test. 1. Will this test change how you treat me? If the answer is no, then why did it? Not every abnormal result leads to action. Sometimes it leads to worry. More testing, or unnecessary procedures. If your care plan won't change no matter what the test says, it's okay to skip it. 2. What happens if I don't do this test? A good doctor should be able to explain the real consequences of not testing. Sometimes, the risk is small or even non-existent, and knowing that gives you peace of mind to say, not right now, or, let's wait and see. 3. Are the risks of this test higher than the benefits, at my age? Remember, a test that's low risk for a 50-year-old might carry serious downsides for someone at 75 or 80. The older we get, the more that balance matters. Shared decision-making. The future of senior care. Good medicine today is all about shared decision-making. That means both doctor and patient bring their knowledge to the table. Your doctor brings the science. And you bring your life experience, your values, and your priorities. And it's important to recognize, even the most caring doctor may still be following outdated protocols. They may recommend tests because that's how it's always been done. Not because it's the best choice for you. That's why your voice matters. When you speak up, ask thoughtful questions, and advocate for yourself, you're not being difficult, you're being wise. You're helping shape a plan that fits your life, not just your diagnosis. Because at this stage, healthcare should be about more than just survival. It should be about living well. Lessons from 30+ years in medicine. After more than 3 decades in medicine, sitting beside patients in exam rooms, ICU bedsides, nursing homes, and family kitchens, I've come to a truth that doesn't get taught in textbooks. Good healthcare is not just about doing everything we can. It's about knowing when to stop, and why. I've treated thousands of patients in their 70s, 80s, and 90s. And do you know what I've learned from those who aged the healthiest and happiest? It wasn't the ones who got every screening, every test, every surgery. It was the ones who chose carefully, who asked questions, trusted their intuition, and focused on living, not just surviving. It's natural to want reassurance as we get older, to chase every opportunity to stay ahead of illness. But if we're not careful, we end up spending our golden years in waiting rooms, hospital beds, and worrying about what might go wrong, instead of enjoying what's going right. The patients who taught me the most. I remember one patient in particular, Frank, 84 years old. A retired firefighter. He'd had a heart scan that showed a mild blockage. His cardiologist recommended a stress test, then an angiogram, and eventually a stent. But Frank wasn't feeling any symptoms. No chest pain, no shortness of breath. So he asked me, "Doc, if I'm doing just fine, why poke the bear?" He chose to skip the procedures. That was 5 years ago. He still walks his dog every morning, grills for his grandkids on Sundays, and says no to what doesn't feel necessary. His body hasn't just lasted, it's thrived, because he's protected his peace, his energy, and his freedom. What I tell my own family. Here's the truth. The advice I've shared with you in this video? I give the same to my own parents. I've told my mother to skip another colonoscopy. I've told my father not to get a full body scan. Not because I don't care, but because I do. Because I've seen what happens when well-meaning tests turn into complications, confusion, and regret. I don't want quantity of life at all costs. I want quality. For them, for my patients, and for you. Wisdom over fear. At this stage in life, healthcare should be rooted in wisdom, not fear. In discernment, not default protocols. In knowing that saying, no doesn't mean you're giving up. It means you're living on your terms. So if you're feeling conflicted about whether to do that next test, ask yourself, will this test give me peace? Or take it away? Will it improve how I live, or just make me live more cautiously? And if I didn't know this thing existed, would it ever have affected me? These are not questions of doubt. They're questions of strength. In the end, the greatest lesson I've learned in 30 years of medicine is this. Your life is not defined by what we find on a scan. It's defined by what you do with the time you have, how you move, how you love, how you live, and that is the kind of health worth protecting. So, let's bring it all together. If there's one truth I hope stays with you from this video, it's this. After 70, healthcare should be about quality, not just quantity. It's about living with clarity, dignity, and energy, not chasing every potential risk under the sun. Too often, we let fear steer the ship. Fear of missing something. Fear of what might happen if we say no. But fear doesn't lead to better health, wisdom does. And wisdom comes from asking the right questions, weighing the real risks, and choosing what truly serves your life. If this message resonated with you, if you've ever felt overwhelmed by the endless loop of tests, checkups, and screenings, know that you're not alone. And more importantly, know that you're allowed to pause and rethink. I'd love to hear from you in the comments below. What's one medical test or procedure you're now rethinking after watching this video? Your insights could help someone else feel seen, validated, and more in control of their own choices. And if you found value in today's discussion, please share this video with a parent, a friend, or someone in your life who might be getting over-tested without realizing it. Here at Senior Health Boost, we're not about fear. We're about freedom, and giving you the knowledge to live your healthiest, most empowered years right now. Hit that subscribe button, tap the bell, and stay with us as we continue to explore the kind of care that respects your age, your wisdom, and your goals. Thank you for watching, and more importantly, thank you for choosing to age on your own terms.